Hello and welcome to Spinecast. Here we are going to unravel complexities of spine, back and neck pain and everything related to spine. Dinesh is the founder of Anssi Wellness and he has got into India a new technology called spinal decompression treatment.
Yeah, it's a technology developed in developed country more than 35 years. So we took that challenge and we brought this technology to India. We introduced the technology to India and now we have treated almost more than 5,000 patients successfully. I helped a couple of my friends to get a job in the United States, and when they get there, before they get there, I lifted a couple of furnitures, heavy weight, and that's how I got a bad back.
Hello and welcome to Spinecast. Here we are going to unravel complexities of spine, back and neck pain and everything related to spine. I'm your host Vikram Kharvi and I have with you in our very first episode Dinesh Dalvi.
Hello.
Dinesh is the founder of Anssi Wellness and he has got into India a new technology called spinal decompression treatment. So let me introduce Dinesh to you, and Dinesh, tell us, are you a doctor, Dinesh?
No, I'm not a doctor. I'm a patient. I was a patient actually.
Oh, so being a patient, you are now treating other patients, is it?
Yeah, it's a technology developed in developed country more than 35 years. So we took that challenge and we brought this technology to India. We introduced the technology to India and now we have treated almost more than 5,000 patients successfully.
Lovely. But what is this spinal decompression treatment?
Yeah, mostly what happens, people usually get neck pain, back pain, and continuously if getting, and when disc get compressed and disc comes out and hit nerves, that's pain starts. When pain starts, then pain, tingling, numbness, weakness, it happens. So in developed country nowadays, they use technology called spinal decompression treatment with no medicines, no injections, no surgery, or any other kind of treatments. It's a machine that helps to decompress the disc, and with the help of computer program. Okay. Actually, before go to the spinal decompression, there are other treatment called hydrotherapy, and after that treatment is muscle stimulation. So in the process of spinal decompression, it exactly counts patient's height, weight, and what are the structure of the spine. And on the basis of that problem, on particular disc, it get compressed through that technology. And once the disc come to normal position, the ultimately aim is nerve gets free. So the symptoms like pain, tingling, numbness reduce accordingly. That's called spinal decompression treatment.
But tell me, what's your story? How did you get this technology to India? What exactly happened that you thought you should get this technology to India? And what is the motivation behind you actually becoming a torchlight for Indians to experience this treatment?
Okay, it's reminded me 2009 when I was in US working in the healthcare and social development field. You know, I helped a couple of my friends to get a job in the United States, and when they get there, before they get there, I lifted a couple of furnitures, heavy weight, and that's how I got a bad back. L4, L5 disc extruded. It was very painful situation. I was not able to sit, stand, walk, and I've been to a couple of hospitals in the United States. And whenever I go, they suggested, the surgery, that's the only option. And you won't believe, one day surgeon suggested this surgery, that's the option, and surgery cost was $80,000. I was like, wow, I mean, it's horrible. And what I did, I came to India. I've been to multiple Indian hospitals. Even Indian orthopedic surgeon suggested surgery, that's the option. So while walking, sitting, sleeping, any position, it was so much painful that time. But after taking medication, physiotherapy, and different treatments, I was not able to get proper relief. So again, I went to US from, like, I would say Mumbai airport to Newark airport. I was like more than 14 hours in standing position because it was so painful.
You stood all 14 hours?
Yeah. Because I was not able to sit in plane, So it was so painful. And after that, I did a lot of research there, And I found this technology called spinal decompression treatment. I read ad that word spinal decompression treatment first time in 2009, I would say. And they have written mention clearly no medicines, no injections, and no surgery. Then I was confused how it is possible. Even though if I wanted to go to a washroom, no, I had to take painkillers, like settle or stabilize for me like for 10-15 minutes. Then I had to crawl to go to washroom. And this technology, they are saying like no medicine, no injection, no surgery. Then I said I should go. Then with the help of my friends, we went there and I met Dr. Joseph Cameron over there. And he's the one who treated more than 30, 40 years, such kind of condition with no medicine, no injection, no surgery, the same technology called spine decompression. Dr. Joseph told me, come on, young man, I'll fix you. I was like, I was not even able to sign the paper properly. So painful situation. And believe me, after half an hour, okay, it's a magic happen. Just after half an hour, 95% pain drop.
Interesting.
And that was like kind of turning point of my life. And I decided that time. I was thinking the same thing, like the past 6-8 months, pain, depression, anxiety, loneliness, financially broke, many things happen. And this treatment is technology is so developed within a half an hour span, pain dropped, and I decided to get this technology to India.
But getting a technology to India means a lot of capex investment.
Yeah, it's true. I mean, it took me in those days 2.5 CR. We took loan also, and initially doctor was not ready to get this technology to India because they were settled in US and everything was okay. But it took me 3 years continuous follow with American doctors, and finally he decided to come with me. So I came with American doctor, American machinery, and we started the technology. Treatment center in India, and now. We have started, Mr. Sumedh and Mrs. Vidya, we have a company called Anssi Wellness. And we started this technology, providing this technology and treatment center in Mumbai, Mulund. And now we have 11 clinics across India. 4 states we are working. More than 5,000 patients we have successfully treated and we avoided surgeries.
When did you start? Which year did you start?
In India, I would say Anssi Wellness started 2019.
So 2019 to 2023, you're saying you've already treated 5,000 patients.
Yeah, initially we started 2012 for the pilot project. So because the transportation system, the way of living, the healthy habits of eating patterns are so different, socially, culturally different, Western country and here. So it took some time, but 2012 to 16 we did pilot project, and Anssi Wellness we started 2019. But all, if you count, more than 5,000 patients we have treated so far successfully.
How many centers you have across the country?
We have right now 11 centers like in Mulund, Kalyan, Vashi, Kandivali, Andheri, Pune, Nashik, Nagpur, Hyderabad, Bangalore, Panchkula in Haryana, and 6 centers we're going to open new here in India and 2 in Dubai.
Oh, lovely. You're going to Dubai also.
Yes, yes.
What is this treatment all about? How much time does it take? And what are the conditions that you treat here at your centers?
Yeah, condition I would say, so 95% spine complaints due to disc compression, right? So it could be bulging disc, herniation, protrusion, extrusion, anatosis grade 1, grade 2, we treat. So out of 95, patients usually come from Delhi, Calcutta, Bangalore, Chennai to our centers. And few patients like Canada, East Africa, Tanzania, Mozambique, Iraq, Iran, from those patients also come to India.
Okay.
Yeah.
So my next question is, what is the entire process? How many days it
Okay.
takes?
So ideally it takes 18 to 20 sessions,
Okay.
right? And
And each session would be for how many minutes?
see, there are 3 different machines: hydrotherapy, spinal decompression, and muscle stimulation. And we also, American doctor add that myofascial release and TENS and different modalities for different conditions. So it took average 30 to 45 minutes per session.
Okay. And patients instantly see relief, or they have to wait for 18 sessions? How does that work?
Yeah, it's depend how severely disc compressed and nerve pinched, right? So I have seen couple of times, patient come with on a wheelchair or on stretcher, and like 4 5 persons or family members, they literally held properly, and walking like baby step, and after a few sessions they are fine.
Interesting. Would you want to narrate any case that that you're very close to, that you've seen very closely, and you've seen a complete transformation in that patient?
Oh, thousands of patients. Um, so one. Which one I tell you? Lumbar,
Anything
sir.
that clicks immediately and which has been close to you.
One lady referred my friend, and she was in the interior village. They had like a chai tapri, and she's having 4 discs. C3, C4, C4, C5, C5, C6, C6, C7, also lumbar, L1 to L4. And 4 discs cervical, 4 discs lumbar, having protrusion and extrusion. She was barely standing and doing her business. When she came, didn't have money, so we gave a discount and started treatment. Believe me, after a couple of sessions, she was able to sit, stand, walk. And after completion of treatment, we called for follow-up, and she started new hotel.
Okay.
That's a transformation. I have seen.
And how does this entire thing works? Do you have orthopedic doctors assisting you?
Yes, 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 yes. We do have, each and every center, we have orthopedic surgeon, MS ortho surgeon, physiotherapist, trained physiotherapist, technicians, and receptionist.
So, are you the only one offering spinal decompression treatment here in India, or there are similar treatments available in India?
See, for spine, allopathic, homeopathic, Ayurvedic, and different pathy treatments are available. But spinal decompression treatment, we are the one who brought this technology to India.
And what's the aim of Anssi Wellness in the next 2 to 3 years? Where do you want to reach? What do you want to do?
See, this treatment basically, I would say, designed for our patients who want to avoid surgery, spine surgeries, right? So we just tried, and couple of years we have reached to 5,000. So our aim is to go to pan India and avoid spine surgeries. So within 3 years we would at least have 100 centers.
100 centers?
Yeah, in India.
Right now you said you have 11 centers.
Yeah, 11, and within 3 months we're going to have 6 centers more.
Okay, and that will all be in Bombay, is it?
Few in Bombay and few in Dubai.
Okay, and which other markets are you looking at outside of India?
Europe and the Gulf countries. Patient, because once you are in pain and you're taking medication, injections, or sometimes surgery patient also come. So because even though after surgery, called like failed back surgery syndrome, so those patients also comes and it's get better result. Not only bulging, herniation, protrusion, but degenerative disc disease. That's also gives best results. Yesterday we have seen one patient who had a L4, L5 extrusion case, and when he came that time last year, 1.5 disc height. And recently I have seen his report. This same patient, the disc height increased to 7 It's a miracle, I would say, in medical history.
Even decreased to 7 from 1.5.
Yeah, it was 1.5 initially last year.
Decreased.
Yeah, and after the treatment and proper posture and protocol, the disc height increased.
Disc height increased.
Yeah,
Okay.
yeah.
One last question before I move on to your advice to people. Can you treat all spine related issues, or there is something that you cannot?
Yeah, actually, I would say 90 to 95% any disc issue we can treat successfully.
Okay.
Only 3 to 5%, like individual having like compression fracture, hairline fracture, tumor infection, TB infection, those need medication or surgical procedures.
Great. Thank you for joining us, Dinesh. Any message that you would want to give to our audience? Because everybody wants to, don't want pain. Everybody wants to get relieved faster.
Sure, sure. See, thing is that we have one spine and we need to take care of that.
Correct.
And आपको पता है लाइफ में रिटेक नहीं होता.
Yeah.
So even though we have technology, we need to take care of spine. Like spine पे प्रेशर ना आए इसके लिए क्या क्या कर सकते हैं. आजकल जो लड़के हैं जिम में जाते हैं, ज़्यादा वेट उठाते हैं, इंस्ट्रक्टर होगा नहीं होगा मगर ज़्यादा वेट उठाने के कारण L4 L5 डिस्कम्प्रेस हो जाती है. मोबाइल का यूज़ ज़्यादा है, राइट. तो वो ध्यान में देखना है. अगर कुछ प्रॉब्लम है तो डॉक्टर के पास जाना है. सर्जरी अवॉइड के लिए डिसपैथोलॉजी के लिए टेक्नोलॉजी है, मगर हम हो न मतलब प्रॉब्लम ही ना हो इसके लिए क्या कर सकते हैं, और प्रॉब्लम हुआ तो नॉन सर्जिकल अप्रोच है.
Thank you, Dinesh. And thank you everyone for being with us for so long. We will come back to you next week with something more interesting. And till then, take care of your spines. Thank you very much.
Thank you.